We at Versus Arthritis funded research in the 1990s that led to a new class of drugs for inflammatory arthritis, known as anti-tumor necrosis factor therapy, also called anti-TNF therapy. But how does anti-TNF therapy work? In the push against inflammatory arthritis, anti-TNF therapy has been a game changer. It can reduce inflammation, it can stop arthritis from damaging people's joints, and it can make a big difference in people's quality of life. Let's take a closer look at how this important treatment option helps people who have rheumatoid arthritis. First, let's talk about joints. Joints are where bones meet, and they allow the bones to move freely without letting them move too far. A capsule and connective tissues called ligaments hold joints together. Joints also have a soft inner lining called the synovium. The synovium makes a thick fluid that protects the joint and helps it to move freely. Thin layers of tough, slippery tissue, called cartilage, create a protective cushion between the bones. But when someone has rheumatoid arthritis, their body's immune system attacks the healthy joint. We don't yet know exactly why the body's natural defense system becomes overactive in this way. But we do know that the activated immune system makes proteins that cause inflammation that can harm the joint. One of those proteins is called tumor necrosis factor alpha, or TNF. Having high levels of inflammatory proteins such as TNF causes the synovium to make extra fluid, and that creates painful swelling that can stretch the joint capsule and even push the joint out of shape. To make matters worse, cells in the synovium start to make enzymes in response to this inflammation, which destroy cartilage. That can mean that the cushion between the bones gets thinner. TNF also contributes to a process that causes bone cells to wear away. So how can we stop this cycle of inflammation and destruction? One very effective way to do it is by treating a person using anti-TNF therapy. Anti-TNF antibodies target the TNF protein so that it can't cause harm to the body. Anti-TNF therapies are biological agents. That means that these therapies, which include treatments such as infliximab and adalimumab, are made in living cells. When someone with rheumatoid arthritis has an anti-TNF treatment injected, either into a vein or under their skin, the anti-TNF antibodies bind to the TNF protein that is circulating in the body. By binding to TNF, the antibodies block the TNF protein from attaching to immune cells in the joints. That means that anti-TNF therapies can prevent inflammation from building up and getting out of control. And anti-TNF therapies work in a similar way in people who have other types of inflammatory arthritis too. Anti-TNF therapies have revolutionized the way we treat people who have inflammatory arthritis, and they have improved life for millions of people worldwide.